Happy Wednesday, everybody. Thank you for joining our Wednesday webinar series. On this evening's session, we have with us Dr. Rob Cockman from MidTown Pharmacy. I'll turn it over to Dr. Cockman here in just a moment. In brief, again, thank you for joining. This Wednesday webinar series brought to you by CareerScript is one component of what we bring to you in terms of your pharmacy career development. Those of you that are familiar, CareerScript brings vision, direction, and accountability to help you make the most of your degree that you have in pharmacy. The vision aspect is about broadening your horizons and letting you see that your degree is in pharmacy, not just in pharmacist. Certainly being a pharmacist, as we'll learn today, is one very rewarding career, but there are many, many things that you can do. The direction is about actually setting goals and setting out on the path so that you can actually achieve the types of hallmarks in your career that you would like to attain. And the accountability component is about empowering those around you to make sure that you're as successful as you can possibly be as you set out on that individual direction. With that, our guest presenter tonight is Dr. Rob Cockman with MidTown Pharmacy. Rob is not only a colleague of mine, but a friend as well, and someone who has a spectacular experience to get to share with you. We're very fortunate to have Dr. Cockman on the phone with us this evening. We'll go through a quick presentation. You'll have the ability to answer a few questions and participate in this interactive session through the chat and polling questions as we go through. If you have questions, feel free to type those in the question box within your webinar, and we're happy to address those towards the end and during the Q&A. With that, it's my distinguished pleasure to introduce to you our speaker tonight, Dr. Rob Cockman. Rob?
Good evening, everybody. Scott, thanks. Before I begin, I'd just like to, thank Scott. I think what he does here with CareerScript is actually, pretty amazing. Considering when we went into pharmacy school, it seemed like there were only, two options available to us. You were either a retail pharmacist or you were a clinical pharmacist, and that's about all you knew as, as a pharmacy student. So I think, getting people to broaden their horizons and to think about what else you can do within the career of pharmacy other than just a pharmacist, I think is a pretty amazing thing, and it's well worth the time that you guys use to look at all of this. But again, my name is Rob Cockman. I'm a pharmacist, and we're going to go through a little bit about what I do, I guess, on a day-to-day basis as an independent pharmacist. Before I do that, though, I'll talk to you a little bit about my background as a pharmacist. So, Scott, if you'll hit the next slide. Yes, I am a pharmacist, and if you're actually looking at the picture, that is me. It is Halloween of last year, and a customer actually took that picture from the drive-through window of our pharmacy. And I was dressed up as Axl Rose from Guns N' Roses. But, through the fun and games and of everything, we still, do our job. What makes me qualified to be a pharmacist? I guess if you start with my education, I graduated from Wake Forest University in 1996 with a Bachelor of Science in Biology and Chemistry. And I taught middle school for 2 years after graduating from Wake because I had no clue what I wanted to do with life other than I wanted to help people. And from that point, I decided to go to pharmacy school, so I enrolled at University of Chapel Hill, or North Carolina at Chapel Hill, graduated in 2002 with a PharmD, and that's where I met Scott, was actually in 2002. He was a resident when I was a student, so Scott actually taught me, which I think is more appropriate than me teaching anybody else. But from that point, when I graduated, for a year and a half, I worked at a program called Alamap, which provided medication assistance to patients who could not afford their medication. The reason I did this was because, honestly, I knew from the get-go I wanted to be a pharmacy owner, and I wanted to work in independent pharmacy, and we'll get into the reasons why in just a little bit. But that allowed me to save money to help open up a store. So in 2003, actually October of 2003, I opened up my first pharmacy, which is MidTown Pharmacy, which is the one that Scott knows about. And for the past 10 years, I've pretty much owned and operated that pharmacy. Just in the past year, we opened up a second pharmacy in Martinsville, Virginia, which is about an hour north of where we are from MidTown. And that's been going well, and we're actually getting ready to work on 2 more stores, looking at opening a new pharmacy at a local university nearby where we are here in Whitsett, North Carolina, and then also we're looking to purchase an already existing store from a pharmacist that is ready to retire. So with fingers crossed, by the end of the next month, I'll be the owner of 4 independent pharmacies, which is something I would not have thought of, when I initially started pharmacy school. I never would have thought I would have been a multi-store owner, but that's kind of where I am now. Scott, you go next slide, please. Okay, I guess I'll turn this over to Scott. He has a couple of questions that you guys have to answer, or at least put in multiple choice guesses on them.
Yeah, thank you very much, Rob. Appreciate that. So we know a little bit about you now. Let's do a little bit of Q&A here for the folks who are on the webinar with us. So in your navigation bar, you will see polling questions, and I will go through a couple of them. So the first question is, which one of these responses best describes you? Are you a pharmacy student interested in independent pharmacy? Are you a pharmacy student unsure of your future career? Are you a pharmacy student just here to learn as much as you possibly can? Or a pharmacy graduate evaluating your career potential and options? If you can respond to those polling questions, it'll help Rob maybe give a little bit more pointed guidance on where to take the conversation and how to highlight some areas for you. We'll give you 4 more seconds here and time. So, Rob, it looks like you got a 50-50 split. Pharmacy students interested in independent pharmacy.
Okay.
Pharmacy students unsure of my future career.
All right, gotcha. Okay.
So that's the first one. We've got one more, so I'll close that poll. Actually, we got 2 more questions. So the next question is, have you ever worked for an independent pharmacy? And those answers are pretty straightforward, yes or no. And those responses are coming in quickly here. And 100% in, you've got 2/3 yes and 1/3 no.
Good deal.
In terms of, yeah, so 2/3 of your folks have worked in an independent pharmacy. And have you ever thought of owning your own pharmacy? Again, yes or no? And as folks are coming in, well, you've got a pretty definitive group on this one. You've got 100% of the crew, 100% voted, and they all said yes. They've all thought about owning their own pharmacy. So you've got a good group of pharmacy students who have given consideration to owning their own pharmacy. Half are pretty sure that's what they want to do, and half are, I think, maybe still on the fence.
Oh, that is great.
So, Rob, I will go to your next slide and turn it over to you.
Okay. Reasons why I wanted to become an independent pharmacist. When I was a student, I think this slide best describes a lot of my interactions with people that told me what path I should go down. When we went to pharmacy school, like I said, you were either retail or clinical, and the pharmacy school staff and the professors there honestly wanted you to be clinical, and that's what they pushed. And they wanted you to do a residency, they wanted you to have clinical experience, they wanted you to work in a hospital. So it seems like I was often butting heads with a large group of staff at Chapel Hill. And so, so every time I read this slide that says I tried my best to see things from your point of view, but your point of view is stupid, I felt more like they didn't understand what I really wanted to do with my life, and they were more bent on one career path, which is why I think CareerScript's so great. But Scott, if you'll hit the slide. Yeah, so I always looked at things differently. I didn't necessarily want to be, a clinical pharmacist. I didn't want to wear the white lab coat and, do med reconciliation or, vanc trough levels and peak levels. That was not something that interested me. I actually was more interested in dealing directly with patients and seeing them in a real world, setting at home. Scott, if you'll hit the button again. The second thing is I didn't take direction very well. And I tell this somewhat jokingly. People ask me why I started, my own pharmacy, and I say it's because I can't take orders very well. I really wanted to be in a business where if, I felt like, I wanted to do something, I could. If you'll hit it again, Scott. So therefore, that pretty much put out clinical pharmacy for me. I decided at that point, retail was where I wanted to go. The second thing, and kind of going, or the last thing, I guess, and kind of going into independent pharmacy is I didn't want to enter pharmacy at my ceiling. Most people either in clinical or retail pharmacy, when they come out of pharmacy school, you're pretty much, for the most part, making what you're going to make for the rest of your career. And there's not as much upward mobility, at least in those two, general settings that we were mainly taught about as students. And, I didn't want to just be pigeonholed into that. I wanted the ability to grow my income as the years went by and show something for, the amount of hard work that we put in to go to school, to establish a business. And so I thought ownership was the way to go for that. Scott, you can go ahead and hit the other slide. Does this fill my emotional bucket? Is working in independent pharmacy, something that is fulfilling? If you'll hit the button again, Scott. I say yes. And one of the main reasons why, and I talked about it a little bit, is I really have the ability to make any decisions that I believe will positively affect my customers without worrying about what corporate will say or do. I can't tell you how many times that I've done something and I've done it just because I wanted to do it. I didn't have to check with anyone. I did not have to worry about what, the pharmacist district manager was going to say. I did it because I knew it was in the best interest of the patient. If I either had to give them medicine, if I had to cut them a break on their price, I got to make that decision, and I didn't have to worry about it. And I go to bed a lot better, a lot more easily, knowing that I can affect those patients in a positive way, being my own boss. The other thing is that we can change directions quickly as opposed to another pharmacy. And I talked with Scott a little bit about it. One of the things we do here at MidTown Pharmacy is we have what's called MidTown Diabetes University. So we take patients that are type 2 diabetics, and actually we also take patients with gestational diabetes, and we have a course that is accredited through the American Association of Diabetic Educators to help those patients learn how to deal with diabetes, what it is, how to treat it, foods, exercise. I mean, it runs this whole gamut, and we actually get paid to do this by Medicare and a lot of corporate payers, commercial payers. And so, that's something I wanted to do. I thought it was something that was worthwhile. I thought the community needed it. So I just, I took one of my pharmacists and I said, here, we're doing it. And we can do that. I don't have to worry about going up the ladder, going through tape. If it's something I feel like we can do it, and we can do it quickly. If you'll hit the next one, Scott. Work-life balance can be better, and I think everybody, at least if you go into retail pharmacy, and especially chain retail pharmacy, you're really not in control of your schedule much, especially if you're going to work full-time. You don't know what your schedule is but a week or two ahead of time. You've got to put in for vacation 2 to 3 months ahead of time, and even then you might not be able to get it. You're called in a lot. You're working overtime. So with independent pharmacy, your work-life balance can be better. Not to say that it is all the time, because, Scott and I were joking today. I mean, he and I talked about 6:30 this morning, and it's now, 7:15 at night, and I've been going strong since about 6:30 this morning. So, today's going to be a 14-hour day. That just is what it is. But as the owner and as I've taken time, I'm able to, take time with the family more so now than I think I would have if I was at a chain retail pharmacy. Scott, if you hit the next one. And your earning potential is up to you. I mean, you can honestly make what you want to make and then some in independent pharmacy. It's still, despite what everybody says, it is still a great profession to be in independent retail pharmacy. Margins are less, but that's true everywhere. Everybody fights shrinking margins. But you still make a great living doing this, and it's something that's rewarding. All right, Scott, next one. Oh yeah, the past can hurt, but you can either run from it or you can learn from it. Famous words from the Lion King. Hit the button again. Things that I wish I would have known before starting a pharmacy. And my one knock on pharmacy school is that they did a really poor job of teaching about independent pharmacy. Now, I did go to Chapel Hill, and I know other pharmacies like Campbell and Wingate do a better job about doing retail, but there's not a great program that teaches somebody about the ins and outs of running an independent or owning an independent pharmacy. And I really wish that they would have had at least a class, at least one semester about retail independent pharmacy. Next slide. The big things within independent pharmacy, I wish I knew how to do ahead of time, and I knew a little bit, but was how to read, use, and integrate the following: a profit and loss statement, a balance sheet, and a cash flow statement. And if you ever think about owning a pharmacy or any business for that matter, you will need to know what those three things are, and you'll need to know how they're interrelated and how they affect everything. I can look at my P&L and I can look at my balance sheet, and I can know where I stand as a pharmacy. Where we're doing well, where we're doing poor, where we need to fix. Those are things I wish I would have, instead of having to learn on the job. I wish I would have been able to have some time learning those beforehand. And it would have been great if they had a semester class about independent pharmacy that also taught the business aspects of it. Next slide. Don't be the face of the franchise. This is the one my wife actually says more than any. When you start a pharmacy, it's tempting to say, I want the customers to come in here and I want them to call me by name, and I want them to say, well, Rob knows me. That's great. And I'll take, I guess a quote from one of my other pharmacists that owns an independent pharmacy. He's a big Michigan fan, as I know somebody else in here is. And so if somebody said, well, who is the coach of, Michigan? And somebody would say Harbaugh. And so, yes, Harbaugh is the coach of Michigan, but he is not the face of the franchise. Michigan is still Michigan. So when Harbaugh leaves, gets fired, whatever, it will still be Michigan. And that's what I say about, pharmacy. You want to set your pharmacy up so that one day you can step away and your pharmacy still runs just as well without you in it as it does with you in it, and that your customers know that no matter who's behind this counter, that person will take care of you, not just you as the owner. All right, next slide. All right, I know we've done a couple of surveys, and most people get a Starbucks gift card for surveys, but I'm poor. I'm a pharmacist owner. I'm an independent owner, so no Starbucks gift cards.
So at this point, thank you very much, Rob. I appreciate that. That was good. At this point, the folks here who are on the phone with us get to dictate what direction you take the conversation from here. So what else do you want to talk about? We're going to launch another survey. You have the chance to vote. Do you want to hear more about Dr. Cockman's current role? More about, can you be an owner of an independent pharmacy? Where Dr. Cockman thinks the world of community pharmacy is going? Or why he feels that Walmart, CVS, Walgreens, etc. are not his competitors? So you could respond, and it'll dictate where Dr. Cockman takes the rest of the conversation. Give me 5 more seconds here. And there's our curve. So Rob, you've got the majority that are asking why Walmart, CVS, and Walgreens are not your competitors. And then if you also maybe want to touch, it looks like a small cohort of respondents are where you think the world of community pharmacy is heading.
Okay.
So with that, I will close the poll.
All righty. All right, sounds good. Okay, so why the change is not in competition? It all stems from my belief, basically, that all the chains are publicly traded companies, and a publicly traded company is beholden to its stockholders. So basically, most of the larger companies could care less about patient care, customer satisfaction, what they care about is the ultimate bottom line. So if you've ever worked in a chain pharmacy, you'll know the first thing that gets cut when they need to recoup money is staff hours. You lose the amount of pharmacy tech help you get. You lose the number of pharmacist overlap hours that you get. So, on an even footing, I have no problem at all competing with any other chain pharmacy, around. It's not even, to me, a fair fight because I feel like what we can offer as far as customer service, personalization, extras in addition to, the pharmacy, whether it's delivery, consultation, medication therapy management, any, MTM, adherence, disease state management, any of that, we can do that much better and much more easily than a chain pharmacist can when they're trying to fill 600 prescriptions in a day and they only have one tech, one cashier, and somebody else called in sick. Unfortunately, the playing field's not always even, and that's why I say that the pharmacies in and of themselves are not my competition. My competition is actually the pharmacy benefit managers, the people that manage prescription lives. Because a big thing that, and this kind of leads into where community pharmacy is headed, a big thing right now is what's called preferred networks, where, your pharmacy is contracted as a preferred provider for a specific network, and it's been very big within the Medicare Part D space because what PBMs say there is that it's saving the government money by lowering copays, lowering costs to patients. What happens is if you want to be preferred, one, you have to be actually offered into the preferred network, and depending on what we call a PSAO, which is basically a contracting organization for pharmacies that you belong to, you may not even get offered it as even a preferred pharmacist, and so patients will get a copay differential depending on their preferred or non-preferred pharmacy. So if I'm preferred, they'll pay a $5 copay for a generic, but if I'm not preferred, they'll pay a $15 copay for a generic. So it financially incentivizes them to use their preferred pharmacy. On the flip side of that is if you are a preferred pharmacy, your rates are less. Our margins are less as a preferred pharmacy, and I think this is something that you'll continue to see in community pharmacy as the percentage of healthcare spend in pharmacy grows as a percentage of overall healthcare spend. I think they're going to look to try and save money wherever they can. I personally think they probably squeeze pharmacy about as much as they can squeeze it, and our margins probably can't handle much more before CVS and Walgreens start to push back on, on margins and not accepting certain plans. But I think the other thing that I see going forward in pharmacy is more of a clinical role in retail, so a clinical retail pharmacist. One of my employees at MidTown Pharmacy, that is what she does. She is a clinical retail pharmacist. She spends only 10 hours a week on the counter. Actually, if you look at the picture over here and the counter where the computer is, I'm right now sitting behind that counter talking to you guys. But she only spends 10 hours, yeah, right there, Scott, only 10 hours a week on the counter. Her other 30 hours a week are running diabetic management classes, which are called DSMT, diabetes self-management training classes. She does all our MTMs. We do follow-up. We do nutrition counseling. We do heart health. We do asthma, COPD. And all of these things, we get paid for. And the next thing that we're working on doing with her is we have a primary care practice next to us, and I am working on contracting the pharmacy with the primary care practice, where she will go sit in the primary care practice 2 days a week, and she has the ability to write prescriptions underneath the physicians there. So much like she's a CPP, but so much like a PA or a nurse practitioner, she has the ability to write prescriptions. The primary care practice gets reimbursed, and we get a percentage of that reimbursement, and then it overall saves them based on a lot of the criteria from the Affordable Care Act. So I see that's kind of where pharmacy is going. There's a lot of push in Medicare about star ratings and, how big of a role pharmacy plays in a plan's star rating and what we're doing to increase those through adherence, synchronization, compliance, and things like that. So, I think it's an exciting time for independent pharmacy and retail pharmacy in general because, what once was is not anymore. Gone are the days where you could just, come in, fill 100 prescriptions and go home and be done. I think there's going to be less reliance on the prescription as a commodity to provide the income for a pharmacy. It's going to be more based off of what our clinical knowledge is, the stuff that we truly went to pharmacy school for. And, and I was talking with another pharmacist, and it was one that I was frustrated with because they kept saying, kinetics has nothing to do with pharmacy. I don't use it anymore in the retail setting. And I'm like, you've got to be kidding me, because, everything works in our body, and this comes from a biochem background. Everything takes a certain specific chemical pathway. Kinetics is like integral into how drugs interact with your body, how drugs interact with other drugs, and it's the basis for a lot of the problems that patients have. They're kinetic problems, and so again, I think that's where kind of pharmacists come in, and where we will ultimately be paid more for is kind of our mind, rather than just sticking pills in a bottle, because Walmart's pretty much commoditized that and sold it at the lowest price possible. I think that's it for that.
Yeah, very good. So I think we'll go here.
Yeah, and I was going to say, yeah, I can't do a presentation without showing my family. Of course, that is me. I'm the guy, the old one. And my lovely wife Erin, and our 4 children, Will, Ben, Kate, and Megan. And they're the reasons why I do what I do. Without the support of Erin, I couldn't be a pharmacy owner. She has a full-time job herself, but with her support and her help with the children, there's no way I could do it. So I always want to thank them for everything that they do, because they make it possible for me to do the thing that I love, which is owning independent pharmacy. If you'll click the button again.
Very special group of people.
Yeah, and one more time. And so I'll leave you with the fact of, why fit in? You were born to stand out. Guys, don't just, and this is my one word of advice, or one, I guess, bit of advice, is don't do something just because you're told to do it. You guys are in a great profession, a profession that truly affects people's lives more so than any other part of the healthcare profession. I truly do believe that. You guys have special gifts to take care of patients. Don't just accept status quo for what it is. Push the envelope, push the barrier. Don't be afraid to do something different. It's you guys. You guys are the future of our profession. And if you guys come out and you come out passionate and you want to push pharmacy forward, we need people that are willing to blaze trails and push pharmacy in directions we haven't been pushed before. So thank you guys so much for listening.
Thanks, Rob. I appreciate that. At this point, we've got 2 minutes left. If there are questions from folks here on the phone, happy to address those. And if there are none, I've got one that I can ask that I'm curious about. So in the browser portion of your webinar, if you could type in any questions that you may have for Dr. Cockman. And Rob, so I'm curious, in the world that I get the privilege of working in, specialty pharmacy is becoming a more and more present and predominant player.
Yes.
I'm curious what your perspective is on how specialty pharmacy is going to impact the future of the independent pharmacy business that you operate in.
I think it's going to be interesting. We'll see how it plays out, because there are a couple of things in play, so it's a little bit more complicated than people want to make it. But if you look at the percentage of overall drug spend and what it's projected to go forward, specialty takes up a huge part. I think pharmacy spend's supposed to double, and most of that is specialty drug. So if you take certain hepatitis medicine, Harvani, which is ungodly expensive. A lot of state Medicaids have broken their budget just based off of this drug alone. So you're seeing these high dollar medications. It's going to be very important for pharmacy to try and get into specialty networks, because what is happening in specialty is that the larger companies like CVS Caremark are carving out the specialty piece and forcing people to use their CVS Caremark because of the margin on it. I mean, if you're selling a $36,000 medication, they're making $3,000 on it. And they don't want everybody to have that opportunity. So, I see a fight for access to specialty pharmacy networks, but I don't think just any pharmacy should be able to do it, because with with a lot of the specialty medications, and what I define as specialty are things that really need a lot of follow-up. Hepatitis patients need a ton of follow-up, and there's a lot of paperwork that's involved with, Hep C. So you need to have pharmacies that have a standard to do it. In North Carolina, we're lucky because in North Carolina we're an any willing provider state. So basically what that means for me as an independent pharmacy is that, if I am willing to accept the reimbursement rate and I am willing to do the things that are required of a specialty pharmacy, the network cannot exclude me, because, our North Carolina statutes state that they cannot. So a lot of pharmaceutical benefit managers, or PBMs, try to make it difficult for us to compete in specialty by putting all these regulations. You have to be, accredited. You have to be, you have to do this kind of follow-up. But as long as we're willing to do it, at least in North Carolina, we have the ability to. But I do see it as a fight, Scott. I really do.
Yeah.
Because it will be huge. But ultimately, I mean, I don't know. It's interesting because, you've seen just in the past couple months the consolidation of manufacturing, like it's unprecedented right now. And so it'll be interesting to see whether the government allows the continued consolidation of all these manufacturers to just, a majority 3 or 4 of them.
Rest assured, it's a big can of worms, right? I mean, you could probably talk for an hour or two just on that topic alone.
Yeah,
the North Carolina thing is interesting. I wasn't aware of that.
Yeah, so
we do have one
Carolina
question here. Sorry, I'll go ahead.
I was going to say it's true of any contract at all in pharmacy in North Carolina. So, the biggest thing for North Carolina was Blue Cross Blue Shield in North Carolina, and our PSAO, which was LeaderNet, was not included in the Blue Cross Blue Shield of North Carolina preferred pharmacy contract. But as an independent, I actually went to Blue Cross Blue Shield and said, you cannot keep me out of this network as long as I'm willing to accept your reimbursement rate, and I adhere to all the guidelines that you have. And ultimately, they had to let me in and be a preferred pharmacy.
Right. So you've got a couple questions here on the phone. Yeah. You've got, I guess, one you could probably handle 2 in the same question. If a student wants this career path, what steps should they take as a student to get there? And you could probably pair that up with, did you have any experience in independent pharmacy before you graduated? Okay.
Yes. I'll answer the second question first. Yes, I did have experience in independent pharmacy. I grew up in a very small town in North Carolina called Houston, North Carolina. And I, grew up around the pharmacy there. The pharmacist and my dad were really close friends, so I got to kind of grow up at a young age up until about middle school, kind of doing little odds and ends. But it got me thinking, about the fact that the pharmacy at the time, especially in small towns, was the hub of the town. Everybody had everything at the pharmacy. Everybody went to the pharmacy. And then when I was dating my wife, I guess she was my girlfriend at the time, she lived in South Florida. And I, of course, having dated her and her living in South Florida, I would love to go down there during the summer. So her dad had bought into about 4 or 5 independent pharmacies, and so he's like, well, do you want to work in them? So over the summer, I would work in the pharmacy down in South Florida. So that's where I really got most of my independent experience. They did a little bit more long-term care pharmacy within it, but they also had independent retail. But that's where I got my experience with independent pharmacy. I actually have never worked for a chain pharmacy, and as one of my other pharmacists so eloquently put it, I would rather prostitute than work for a chain pharmacy. But let me see, and that leads into the next question is, how would I go into if I was a student owning a pharmacy? Which is a really interesting question. A lot of people think that the biggest barrier to owning an independent pharmacy is money, because they cost a lot. They don't want to start one up, and I would argue against starting one up to start with. I think it's a longer road, learning that lesson the hard way. Although I'm proud of what we've done with MidTown. I mean, it took a good solid 5 years to be profitable and for it to stand on its own without help building something from scratch with no customers the day you open. So my recommendation is when you graduate to see if you can get into any kind of pharmacy job. And I think Scott and I talked a little bit about it, is work pharmacy for a couple of years and save your money, save the extra that you have, and then go to wholesalers. Like our wholesalers, Cardinal Health, they have what's called a pharmacy transition team, which they pair pharmacy owners that want to sell with pharmacy owners that want to buy. And we also talked about the fact that there are certain banks that will lend to pharmacists hands down with very little money down. We're talking less than 10% down, up to some deals have been done where you don't have to put any money down, where the pharmacist that is selling the pharmacy basically holds some paper in the business, which is basically your percentage of putting it in. So I say work a couple years, save a little bit of money, show that you want to get in it. If you can get into an independent pharmacy where the pharmacist owner is in his late 50s, early 60s, even better. The pharmacy that we're looking at buying, and we're in the final stages of negotiating that one, he's 61. He's ready to retire. His pharmacy's doing 400 scripts a day. They're doing 50 compounds a day. It's a great pharmacy. They have 5 pharmacists on staff. They have 10 technicians. They do a lot of clinical work. I mean, it's a great pharmacy. So, and don't be afraid to move somewhere where there's a great pharmacy. And then once you do find one, become part of the community there. Because once you become part of the community, people, respect that, and they want to do business with somebody that's part of the community.
Dr. Cockman, I want to be very respectful of your time. You've been very gracious. We do have a couple more questions, but I might ask that we'll turn those over to maybe email, and if I can send those to you, if you could give us maybe a couple lines in email so you can spend a little bit of time with your family this evening. It's obviously, as you mentioned, been a long day.
No, it's okay.
And as a token of our thanks for your donating your time very generously, we've made a donation to your charity of choice, Hospice and Palliative Care of Greensboro, earlier today as a modest token of our thanks. For those of you who are on the phone and those that you may be listening to the recording, we do record these sessions, and they will be posted within CareerScript under the forum section. If you've missed the previous webinars that we've done, the recordings of those are out there now. This one will be out there sometime next week. Please be sure to join our next webinar session. This is the 3rd Wednesday in August, 7 p.m. We have Dr. Greg Daniels from the Brookings Institution in D.C., who also has a pharmacy degree and does something in a very unique career path. He will be our last Wednesday webinar series of the summer, as many of you are heading back to school. And with that, I want to thank you very much for your time. Dr. Cockman, thank you again so much. And we look forward to having you join us on future webinars.
Yeah, absolutely.
Have a great evening, everyone. Thanks, Rob.